Welcome back to the final portion of library instruction for practical nursing students. I hope you enjoyed the zombie video and the Looney Librarian. They really helped me with understanding the process of evidence-based practice research. So I hope they helped you too. Now, another part of this research, and a very important part for nurses, is coming up with a clinical question. So, there's a certain procedure that's followed called a PICO question. A PICO question is really important because it serves as a guideline when doing a nursing intervention. So, when you're looking at your patient, you can use the health problem and address the nursing problem through a framework. And creating this question is has some very specific elements. So the question is called a PICO question, and this is also asked on NCLEX and HESI. So this will be something you hear over and over again. So the PICO question is made up of the elements of population, intervention, comparison intervention, outcome, and time frame. And I know that probably just sounds like it makes no sense at this point, but you'll see it'll come together, and then it will aid you in the actual research that we're going to do. So here's an example of a clinical question using the elements of PICO. What is the effect of clean versus sterile urinary catheter insertion on urinary tract infections in women who have undergone gynecologic surgery? This is a classic question for intervention for nurses. So the population we can see is the women who had gynecologic surgery. The intervention is the clean urinary catheter insertion, and there's a comparison in this one. There isn't always a comparison. Sterile urinary catheter insertion, and then the outcome is urinary tract infection. Sometimes there will be a time frame, sometimes not. So these are the search terms that you actually use to formulate your question. So here's another example. And we'll do a couple of these. Does dietary carbohydrate intake influence healthy weight maintenance in patients who have a family history of obesity? So the way you would have come up with this is population, you had family history of obesity, intervention, dietary carbohydrate intake, and then comparison is none, and the outcome is healthy weight maintenance. So you can come up, whoops, I'm so sorry. You can come up with your own problems with your clinical patients. I've been using my cousin Sophie, who lives in California, as a sample to come up with some PICO questions for several years now. So Sophie had a cancerous brain tumor at the age of 8.5 months and has gone through various radiation and chemo protocols throughout her life. Right now, she is not having any chemo. She has a stabilized tumor. Things are looking really great. Her family's gone through a lot, but she's looking forward to Christmas. And I thought we would come up with a PICO question for Soph. So, she, because of going through so many medical procedures throughout her life, it kind of became second nature. But she did have a procedure that was painful when she started having anxiety. So now she has music therapy is one of the avenues that she's had for anxiety. So I thought we could come up with a question for that. So, what kind of question could we ask? Let's see. Our population would be, think about it, pediatric cancer patients, children with cancer, cancer patients. Our intervention would be music therapy. Comparison, you may have something else. They had tried weighted blankets at one point. You could think of that in coming up for your question. And our outcome with Sophie right now is thankfully not tumor growth, but rather, which in the past we did some searches because of that. Um, but right now we're looking at anxiety, which is something that has been controllable with music therapy. So we're going to go do some actual searching now after all of this background historical and information leading up to evidence-based practice. So where we need you to go is out to the library. So we're going to go to www.ccbc.edu. There we are at the Community College of Beaver County under Campus Life, the library. And there's our chat cow again. Okay, everybody's going to think I have a whole herd. But here we go. We need to go to research tools. And there would be the books if we were looking for them. And here are the research databases. They're pools of information where we can, that are especially selected, that you can go to, that have that credible high-end studies and nursing journals. So I always tell everybody there are various databases and they're like shopping. You want to pick the store of information that's for you. And again, we wanted to get you away from just going out on the web and searching. So you can sign in with your username and password. Now, if you were on campus, you would just put your name, Terry.Gallagher or whatever your name is, and your password. But when you're at home, you use the whole email. So again, this is your Blackboard, your email password, and you sign in. Okay, it's taking a minute today. And then you choose this top link. And there are, under the EBSCO overarching name, there are several databases on here, as you can see as you go down through. And there's just a description with each one. And I always say, read the description to see if that's where you should be looking for your information. Now, for you as nursing students, you have some very specific places to go. HealthSource and CINAHL. We buy these databases that contain nursing and medical journals just for you and for these assignments and making this part of what you're learning how to do. So Academic Search, this first one, is also a pool of information that would have some studies for you on nursing subjects, but for the most part, you're going to stick with HealthSource and CINAHL. I want to show you down below too. There's also a drug database that we get especially for the nursing and health sciences students. So you choose those. I always say do not check select all because you get too many returns. So we're going to go in to do a search. And this is not a good search, but I'm going to show you just off the top. We were talking about Sophie and music therapy and how it's helped her anxiety. If you just did a search on music therapy, you're going to come up with, 7,400 returns of articles. And that's way too many for all of us. So the whole thing with doing the research for evidence-based practice is honing in on those PICO terms and honing in on what you need to know for your intervention for your patient. So the first thing I always say to do is if you're looking in our databases is go for full text because you're going to be presenting this article. You can't use a summary and abstract. So you can choose full text. And you can see that already took it down to 2,000. You must have a scholarly or peer-reviewed journal because you're nursing students. It's no longer, remember how we talked about Googling and WebMD and Women's Health. Those are no longer high enough credibility for what you would be using for your patients. So you definitely must have peer reviewed. So that takes it down a little bit more. And then the other thing with nursing, you have to stay in a 5-year time period because things are always changing and being updated. And you want to have the latest information for your patients. So you can see that took it down to 751. So the thing I would add, though, is that that's not exactly how we want you to do the search. We went through the PICO procedure so you could see how a better way of doing searches for nursing journal articles. So what you want to do is start with your advanced search. Okay, so remember some of those elements. Now, when you go to advanced search, you do have to put your parameters back in. So your be full text 2015 to 2020. And I did want to mention if you were doing something like COVID or even the opiate epidemic, you could move that 2015. Of course, with COVID, you're going to want to move it up to 2019. But with the opiate epidemic, things have been changing. There are, you might want to put it within 3 years or 2 years, and always check that peer reviewed so you make sure you're not just getting news. There are some other options here too. You could actually pick evidence-based practice, and that's if CINAHL is available. I usually start with just those parameters that we are looking at, and definitely always play around with synonyms, or you could have pediatric cancer patients. You could just do cancer patients. And let's just do a search because we had well over. So that automatically has taken it down to 39, which is more manageable. The other thing you could add was our outcome anxiety with Sophie and how music helps. Isn't that beautiful? Okay, so we'll do that search. And we're down to 18 articles. So that's just the process. Now you have to analyze the articles too. So let's say if we were looking, this first one is actually one of those systematic reviews. So it's one of remember the pyramid, it's from the top of the pyramid. And your early articles may need to be original research. So they may be one of the articles lower down on the pyramid. But anyhow, let's go ahead and let's just pick this one. I'm not necessarily saying this is the one that you would use, but just to show you the procedure. So if we choose this article, we can look at it as we would how it would appear in a magazine if you were holding it in your hand as a PDF full text, or just more with the bare bones text. So let's say this article is one that we wanted to choose, and you'll see, remember how I said there are a lot of authors, and the one thing you want to pay attention to is that methodology. So this one is original research. It's a small sampling, but we had others to choose from. And again, I'm just trying to show you what you're going to see and how you're going to analyze. You just don't go in and pick an immediate article. This is time consuming. So let's say if this was one that we decided we were going to do to present to our nursing class this semester, you could email it to yourself at your home email or your CCBC email, so you had it later. You could pick from 3 or 4 that you want to analyze to see what would be best for presentation to your class. You can save it to Google Drive. You can print it. Always remember when you print to do the download because sometimes it'll just print the first page and then print it. And the other thing you can do is you can get the citation. So to show the home address and show your professors where you got your information, which is very important to show credible information, this is where you go. If you were taking an English class or something, you would be going down to MLA, but APA is the nursing reference language. So you could copy and paste this. Now you have to do your due diligence and make sure that it is done correctly. This is a computer doing the citation, so you have to check, but it's really a good start for you. So, and if you decided that wasn't what you wanted to look for, you could go back to the result list and look for more articles. And remember, it's always about widening and narrowing your search. And that's why we're here in the library. It's one of the main things besides reserving rooms that we do is help find that evidence-based practice article. Some of the nursing professors want to make sure it's written by a nurse. But for this initial assignment, please, if you have any problems at all, there are directions out on the web in the course-specific resources, but we would be glad to walk this path with you. So it's very interesting for you to be able to find information, and I hope you got something out of this today. So thank you. And we will have also, let's see, let's go down here. We'll have a little assessment, and I think you'll find it pretty easy to do. It's on forms. I will have this out under course specific where the videos are. So make sure that you do that so you get credit for watching the videos. I know I am not the best speaker I feel like I'm better live than being recorded, but these are the times, and please always come to me if it is too much. That's the herd again. So anyhow, do your assessment and get credit. If you need help, come see me or call me, chat with me. And always remember, at the end of the day, people won't remember what you said or did, but they will remember how you made them feel. Thank you so much for listening.